Okay, this is an entity I just learned about. You know, I just started at Mayo, and one of my colleagues is Cookie, and her fund of knowledge always intimidates me. And this was one of the things that I learned from her recently. So I have two cases. I queried our database for cases, where this was brought up as a differential diagnosis. And I'm curious to see if any of you are going to bring up this within the differential diagnosis. So here's the first SNA. We have these little focal areas of small bowel thickening right there with narrowing. It's enhancing the mural enhancement, and it's multifocal, focal strictures. There's no upstream bowel obstruction. So these are not, causing up bowel obstruction. So that's the first case. Here's a second case with similar findings. You have multifocal areas of strictures or narrowing with enhancement, wall enhancement. So what do you guys think? What are you gonna say in your differential diagnosis? I don't think I would have ever included this in my DD.
I have a theory, but
Now
I want to let other people chime in. Anyone want to
Gloria,
chime in or speak
I
up?
saw Olga.
Olga actually has a case she's going to present next, so that's exciting.
Okay, all right. Any
Anyone
guesses?
else want to guess? My guess.
I don't feel alone here.
My guess is NSAID strictures.
Yeah. So that's exactly. The first one was like diagnostic for NSAIDs enteropathy, and the second one was Crohn's or NSAIDs induced enteropathy. I just recently learned about this, but patients who take chronic NSAIDs are at increased risk. We know about gastritis and duodenitis and stuff, but they can cause focal strictures, and they call these strictures mucosal diaphragms. And they're thin, they're less than 3 millimeters, circumferential narrowing, little waist. And unlike sort of Crohn's strictures, for example, the mucosal diaphragms, it doesn't distort the outer bowel wall. It doesn't distort the outer bowel wall. But it can lead to luminal narrowing. So that's why they call these diaphragms. And so within the differential diagnosis, we include NSAIDs enteropathy, Crohn's, and this other condition that I just learned about, cryptogenic multifocal ulcerous stenosing enteritis, which I learned about from this radiographics paper that Kugi and Amy Hara co-authored. So this is an example that they showed in the paper, and so you have these short segment focal strictures with sort of enhancement, like mural enhancement, and they look very similar to Crohn's, but patients often don't have history of Crohn's. Questions?
That last one, the CMUs, I mean, that basically sounds like a diagnosis of exclusion. Like you wouldn't necessarily proactively say that.
Right, absolutely.
Okay, awesome.